Bismillahirrahmanirrahim. This is Dr. Nighat Naeem from Department of Biochemistry. Today I'm delivering my lecture about excretion of cholesterol. My previous two lectures were about the metabolism or synthesis of cholesterol, and this my second lecture was about the regulation of cholesterol synthesis. And this is about how the cholesterol is excreted from the body. Cholesterol can be excreted from the body either as such in the form of cholesterol, either in the form of bile acids or bile salts. Some of the cholesterol is modified by bacteria in the intestine and change the cholesterol into caprostenol and cholestanol. Together with the cholesterol, these compounds make up the bulk of neutral fecal sterols. The cholesterol, as I have told you before, that the main source of excretion of cholesterol is in the form of bile acids. So first of all, we'll go through what is the structure of bile acids. They are 24 carbon compounds. Bile acids, they are cholic acid and chenodeoxycholic acid. In the diagram you are seeing the structures of cholic acid and chenodeoxycholic acid. There may be the two hydroxyl groups, or there may be the three hydroxyl group in the form of cholic acid and two hydroxyl group in the form of chenodeoxycholic acid. Its pKa, the carboxyl group of these bile acids, they have the pKa of about 6. In the intestine, it will be the structure of bile acids will be in the form of half protonated, means in the form of bile acids, and half deprotonated in the form of bile salts. The term bile salts and bile acids, they are frequently used interchangeably, so don't confuse about if sometime I say instead of bile acids, bile salts. They can be used in interchangeable form, but I'll show you what is the difference between the bile acids and bile salts. These bile acids and bile salts, they have both polar and non-polar phase. There you have seen its structure that they contain the hydroxyl group and methyl groups. These two groups, they are in opposite orientation. The hydroxyl group is in alpha orientation. It means that they lie below the plane of the ring, and methyl group present in the structure of bile acids, they are in the beta form. It means they lie above the plane of the rings. So this make the structure more amphipathic, and so these bile acids and bile salts, they act as emulsifying agents in the intestine. So dietary the lipids which we are taking in the diet, they prepare these dietary triacylglycerols and other complex lipids for degradation by pancreatic digestive enzymes. How these bile acids, they are synthesized? They are synthesized in a multi-step pathway, and resulting into the formation of cholic acid and chenodeoxycholic acids. Here in the diagram you are seeing that in a multi-step pathway there is only one step, which is a regulator step, and this is catalyzed by enzyme cholesterol 7 alpha hydroxylase. This is the structure detail pathway which shows the formation of bile acids primary bile acids, secondary bile acids, and their conjugated form and unconjugated forms. So let's start with the cholesterol. The first reaction, cholesterol into the 7-hydroxy cholesterol, it is catalyzed by 7-alpha hydroxylase. I have told you before that this is a regulated step which is catalyzed by 7-alpha hydroxylase. And this is a typical monooxygenase enzyme, and it requires NADPH and cytochrome P450. Oxygen is required, and it can be inhibited by bile acids or vitamin C deficiency. The next step, we can be divided these steps into the two pathway. They are also the hydroxylation step, and NADPH is the monooxygenase system is present in these enzymes, and NADPH is required and can lead to the formation of cholic acid and cholic acid. Their conjugation with these two compounds, cholic acid and cholic acid, they can be conjugated with either taurine and glycine and forming the taurocholic acid and glycocholic acid. And here in the same way with the cholic acid, glycine and taurine, they can be conjugated with cholic acid. Now in the intestine, these two conjugated groups, taurine and glycine, they can be deconjugated, right? After deconjugation and dehydroxylation, they can change into secondary bile acids in the intestine. So after deconjugation and dehydroxylation, the compound form will be the deoxycholic acid and lithocholic acid. These are the secondary bile acids. So these are the few points which I have told you already, that glycine and taurine, they conjugate with the bile acids with amide linkage, and new structure formed. They are the glycocholic acid, glycokinodeoxycholic acid, taurocholic acid, and taurokinodeoxycholic acid. And also, when they are removed in the intestine by the intestinal flora, they will lead to the formation of secondary bile acids. What is enterohepatic circulation? These bile acids, they are synthesizing in the liver from the cholesterol. You are seeing that here daily 0.5 gram per day is produced, and 0.5 gram per day it is excreted out from the intestine, and other amounts, which is about 15 to 30 gram of the bile acids, they are total there is the 15 to 30 gram of the bile acids which are circulating from the liver into the intestine. The secretion of bile salts into bile and their passage through the duodenum, where some are converted to the bile acids and into the primary, and then into the secondary, their interconversion, their deconjugation, and their all this circulation, and then they are reabsorbed back to the and come to the portal circulation, and converted go back to the liver. All this circle from the liver to the intestine and again to the liver, this is called the enterohepatic circulation. If in the bile there may be there must be a proper proper ratio of phospholipids and bile salts. If this ratio is disturbed and the more cholesterol is present in the bile, then this cholesterol can be deposited as stone, which can lead to the cholelithiasis. And this is mainly due to the bile salt deficiency, because bile salts they are meant for the actually solubilization of cholesterol. So these are some of the reasons, some of the disorder, some of the causes which can lead to the bile salt deficiency, called cholelithiasis. This may be due to the malabsorption of bile acids, obstruction of biliary tract, severe hepatic dysfunction, or excessive feedback suppression of bile acids. If the bile acids will suppress the synthesis or suppress the metabolism, then the cholesterol will not have any way out to excrete it out. And its treatment, they may be the laparoscopic cholecystectomy or oral chenotoxic cholic acid as a drug form, and which will lead to the absorption, which will lead to the dissolution of stones. What are the clinical aspects in all the metabolism of cholesterol? Cholesterol can be deposited inside the artery walls, and which can cause the inflammation and can lead to the atherosclerosis. So atherosclerosis, it is a inflammatory disease characterized by deposition of cholesterol and cholesterol ester from the plasma lipoprotein into the artery wall, and this atherosclerosis, it is the major cause of heart disease. Elevated plasma cholesterol level are one of the most important factor in promoting atherosclerosis. There are some disorders which are like diabetes mellitus, lipid nephrosis, hypothyroidism, hyperlipidemia. They can lead to the elevated level of VLDL, RDL, chylomicron remnants, or LDL. They are accompanied by the premature or severe atherosclerosis. So HDL, it is a good cholesterol. So there is the inverse relationship between HDL concentration and coronary heart disease. So HDL and LDL cholesterol ratio is a good predictive parameter. What is the role of diet in reducing the serum cholesterol level? There are several hereditary factors also which may play a role in heart diseases, but diet play a very vital role in promoting or reducing the serum cholesterol level. Substitution of poly and monounsaturated fatty acids, they are beneficial. Corn oil, sunflower oil, and sunflower seed oil, they contain the omega-6 polyunsaturated fatty acids. Olive oil, they contain monounsaturated fatty acids and omega-3 fatty acids, which is also beneficial. It is found in the fish oil and they are beneficial. However, the butter oil, beef fat, palm oil, they contain high proportion of saturated fatty acids. And the substitution of sucrose and fructose in diet, carbohydrate, it is also a main culprit in promoting and raising the level of blood lipids. How these unsaturated fatty acids, they lower the blood cholesterol level? This is by upregulation of LDL receptors. So substitution of monounsaturated or polyunsaturated fatty acids, they will upregulate or increase the LDL receptors on the cell surface, and then increasing the LDL receptor means increasing the catabolic rate of LDL. LDL, it is the main atherogenic lipoprotein. And omega-3 fatty acids, they are believed to be protective because of their anti-inflammatory and triglycerol lowering effects. And why the saturated fatty acids, they are harmful? They form smaller VLDL which contain, and this is the lipoprotein which contain more cholesterol, and it is regarded as atherogenic. And our lifestyle, it has also main effect on serum cholesterol level, high blood pressure, smoking, male gender, obesity, particularly abdominal obesity, lack of exercise, and drinking soft as opposed to hard water. They play a very important role in promoting the cardiac heart disease. Emotional stress and drinking too much coffee, it can also lead to coronary heart disease. Premenstrual women, they are protected against the coronary artery disease, heart disease, because of the increased level of estrogen. And the moderate alcohol consumption, especially the red wine, the studies also shows that it can lower the incidence of coronary heart disease because it contains antioxidants. So also when our diet and when our lifestyle, it fail to reduce the serum cholesterol, and we have the cholesterol, a high level of cholesterol in the blood, so then there are some drugs which can prove which can prove its effect in lowering the plasma cholesterol level. They are the statin drug, estimide, clofebrate, gemfibrozil, and nicotinic acid, and they can lower the plasma cholesterol level. So this was all about my today's lecture. Now your topic of cholesterol metabolism, which included its synthesis, regulation, and excretion, it is now complete. So best wishes and good luck.